I have a particular interest in biomedical engineering, so my topic is on how an AI machine learning model can accurately predict the risk of sudden cardiac death in patients with hypertrophic cardiomyopathy, or HCM. Biomedical engineering is a very large field, so this is just one small example of computer science and medicine coming together to solve complex problems and improve human health. HCM, or hypertrophic cardiomyopathy, is the leading cause of sudden cardiac death in young elite athletes. And while the overall sudden cardiac death rates in that population have decreased, they remain highest in NCAA Division I male basketball players. So HCM is a genetic disorder of the cardiac sarcomere, or muscle cells of the heart. A person with this disorder has abnormal sarcomeres that cannot produce force efficiently. This causes a cellular stress which activates hypertrophic signaling pathways, which result in enlargement of cardiac myocytes. So there is an increase in the size of cells, but not the amount of cells. This leads to structural changes in the heart, like an asymmetric thickening of the left ventricular wall and fibrosis or scar tissue throughout the wall and the intraventricular septum. So it's this scar tissue that becomes the basis of cardiac arrhythmia, or an abnormal heartbeat, which can be the precursor to cardiac arrest. So how exactly does this scar tissue contribute to an abnormal heart rhythm? In a healthy heart, electrical signals move in a smooth, organized wave to sustain contraction and relaxation of the heart. Fibrosis disrupts electrical conduction because scar tissue does not conduct electricity well, so the signal slows down or gets blocked. When the signal is slowed or blocked, it can loop back on itself instead of moving forward. So this looping electrical activity is called a re-entry circuit, and it can trigger dangerous rhythms like ventricular tachycardia or ventricular fibrillation, both of which can stop blood flow and cause sudden cardiac death. How does acute exercise affect those with this condition? During a single bout of activity, like a fast-paced basketball game or a 400-meter sprint, the heart has to work harder and faster to meet the body's increased oxygen demands. So heart rate spikes, sympathetic activity increases, meaning there's a surge of adrenaline, ventricular filling time shortens, and electrical excitability increases. So in a normal heart, that's a healthy response. But for someone with hypertrophic cardiomyopathy, that physiological stress can trigger arrhythmias or abnormal heart rhythm. Before I talk about artificial intelligence, I would like to briefly describe neural networks. Neural networks are called neural because their structure and function are inspired by the human brain's network of neurons. So just as the human brain uses billions of neurons to process information, artificial neural networks use interconnected nodes to solve complex problems. In the most simple neural network, it's called shallow neural networks, the artificial nodes are organized into 3 layers. They have an input layer, a hidden layer, and an output layer. And these layers communicate with each other with signals, which mimics the way human neurons communicate with electrical impulses and synapses. Each of these node connections have weights, which represent the strength of the connection, similar to how synaptic strength varies in the brain as well. And these networks learn by adjusting the weight of the connections to improve performance over time. In contrast, a deep neural network contains an input layer, an output layer, but multiple hidden layers, which can range from several to over 1,000. These networks can perform highly complex tasks like image recognition, natural language processing, and speech recognition because they learn patterns from large amounts of data. This technology is the foundation for many of the AI models being used and developed in medicine today. So the AI model that I would like to talk about is called the MAARS system, which stands for Multimodal Artificial Intelligence for Ventricular Risk Stratification, and it's a machine learning AI model that can predict the risk of sudden cardiac death in individuals with hypertrophic cardiomyopathy. So how this system works, so if you can just think of 3 to 1, it takes 3 streams of data and fuses it into one. So it has 3 inputs. It takes data from electronic health records, which includes demographic information and medical history. A second branch takes prior cardiovascular magnetic resonance imaging. And the third branch takes the reports or diagnoses made from any and all cardiac MRIs or echocardiograms. So each of these branches provide input to a feed-forward neural network, which simply means that the data moves in one direction. And these neural networks are connected to a fusion module, which is a deep learning network that is trained to fuse knowledge from these input branches and predict a patient-specific sudden cardiac death arrhythmia score. In addition to calculating the risk score, the AI model was able to recognize critical scarring patterns on the MRIs that were associated with elevated risk. It was also able to identify specific risk factors for individual patients so the doctors could tailor medical treatments for each patient. So what does this mean? Currently, the clinical guidelines used by doctors to identify patients at risk for fatal heart attacks have a 50% accuracy rate. The AI model had an 89% accuracy for all patients and a 93% accuracy in people that were 40 to 60 years old. So this has the potential to transform clinical care and can be adapted to a wide range of the population, from young elite athletes to older adults. So now, circling back to NCAA Division I basketball players, I'm going to use Chapel Hill as an example because I'm partial to Chapel Hill and I love Chapel Hill. But in terms of feasibility, implementing an AI model similar to MAARS at a program like UNC basketball would be realistic, not as a universal screening tool, but used selectively for athletes that are flagged during routine screenings with abnormal ECGs, echocardiograms, or a suspicious family history. This predictive AI model allows a shift from a one-size-fits-all screening to personalized predictions. So for athletes with hypertrophic cardiomyopathy, this could mean earlier identification of risk, better prevention, and more informed exercise prescriptions. Also, the computational demand of this system is not extreme. It doesn't require a massive computer infrastructure or a data center. It can be run on standard computer workstations, and at a high resource institution like Chapel Hill, there's already access to cardiac imaging facilities, sports physicians, and biomedical engineers who could support implementing this process. So at the end of the day, the goal is not to replace doctors with AI, but to strengthen clinical judgment. This in turn can better protect athletes and support safer participation in sport. So that's all I have to say on this topic. Thanks for listening. Peace out.